Every dog that isn't on heartworm prevention medication is at risk for acquiring heartworm disease and becoming sick. It all starts when a mosquito carrying microscopic heartworm larvae takes a bite, leaving the tiny heartworm larvae behind to infect the dog. Over the next several months, these worms invisibly develop within the dog, ending up in the major arteries of the lungs.
Kelsey, come on, boy. It's time to come home.
Mature heartworms live in the arteries of the lungs that deliver blood from the heart to absorb life-sustaining oxygen. Here, the heartworms can grow in length to as much as 1 foot long. The presence of heartworms in the vital blood vessels of the lungs can cause problems ranging from coughing, difficulty breathing, energy loss, dizziness, and even death. All of this is happening invisibly. The good news, though, is that your veterinarian can diagnose a heartworm infection with an easy blood test.
Kelsey, time to go to the vet.
Has Kelsey been taking heartworm preventives?
No, but I didn't think there was any serious risk for Kelsey getting heartworms. You don't hear about it much.
There's always a risk. The heartworm infection is transmitted by mosquitoes. We'll need to test Kelsey just to make sure that he's heartworm-free, and then we can discuss a prevention plan.
Why not just go straight to the prevention plan?
We have to see if Kelsey is infected with heartworms before we can put him on a preventive program.
So once he's on preventives, are future tests necessary?
Yes, it's important to have an annual heartworm test because it ensures that Kelsey stays heartworm-free. Even though your dog is taking a heartworm preventive, missing even 1 dose can provide enough time for a heartworm infection to develop and cannot be stopped by simply putting your dog back onto a monthly preventive. I'm afraid to say that Kelsey's results came out positive for heartworm.
Really? How could that be? He doesn't look any different and his behavior hasn't changed.
Just because Kelsey isn't acting or looking any different doesn't mean that he's not infected. We're just lucky we caught it sooner than later. In some cases, dogs who aren't infected with a lot of heartworms or who aren't very active may show very few signs of heartworm disease, but it doesn't mean that their condition can't get worse. Dogs with heartworms may develop a cough, can tire easily, and they may develop breathing difficulties, dizziness, and even heart failure. If we don't treat Kelsey, he could be facing future health problems, or even death.
Even death?
Yes, this is a serious problem. We don't know how many heartworms are in Kelsey, but his lung radiographs already show some changes. So heartworms in Kelsey are causing some damage to the lungs. And they may also be causing the heart to become overworked. Kelsey seems fine now, but that could change.
Wow. I didn't know that it could get so bad. Well, what do we need to do and how much will this cost?
This isn't going to be an easy process on you or Kelsey. The treatment involves injections with an arsenic-based chemotherapeutic drug, administered as part of a multi-step process that will require you to bring Kelsey in on separate visits to stay with us. The injections can cause some painful swelling, and when you kill the heartworms, they can cause a reaction within the lungs. While this is occurring, Kelsey will need to remain inactive, which is why Kelsey will be confined to a crate for 8 weeks during his recovery. As for the costs, in most cases, the complete treatment, including testing and hospitalization, costs around $1,000.
I have to say, I really wasn't prepared to hear that. I just expected that treatment would be fairly simple with a pill, like for other worms.
I understand. It is a serious treatment for a serious problem. But if the proper precautions are taken, dogs generally do very well.
How did it get to this point? I'm sorry that it had to lead to this. I just didn't know.
After our last test result, it looks like Kelsey has tested negative for heartworm. It's been a long process, but it looks like he's made it through.
I never realized how hard this was going to be, especially on Kelsey. Not to mention the cost and the time it took out of my schedule. I sure hope that heartworm prevention is not as difficult.
Actually, heartworm prevention is easy. It's an oral medication that is given every month. We recommend it be given on the first of every month. The prevention medication is relatively inexpensive compared to the cost of treating your dog with heartworm.
Wow, really? But is medication really the only way? I'm just afraid it'll be tough on Kelsey.
No, not at all. It's easy to administer and will protect Kelsey from future heartworm disease. You need to be sure to give the medication to Kelsey every month because it does not prevent dogs from being infected with heartworm, but rather kills the early developing heartworms. If you miss a dose, the heartworms will get older and less susceptible. Also, you will need to administer the heartworm preventive year-round. I know that we may not have mosquitoes out all the time, but we cannot predict when the threat of transmission is gone.
I don't want to have to go through this again, and neither does Kelsey. I always thought that it would cost more to give the monthly meds than treatment. But then again, I also thought heartworm wasn't a big deal. If I can prevent this process from happening again, I'm willing to stick to the monthly doses and keep those heartworms from coming back. Kelsey, come on, boy.